So in the spring of 2012, MedStar was approached by CRISP to look at their single sign-on option. CRISP had an online portal, but they were looking at increasing usage of it. At the same time, MedStar was implementing an internal HIE, and they were looking at addressing some integration challenges internally. And we noticed that not only did we have to gather up information from all of our hospitals and present it to the clinicians, but we also saw the value of being able to provide the clinician data from other facilities. And the single sign-on option with CRISP was an obvious choice for us.
What we've worked with CRISP on is the ability for a provider, for example, who has a particular patient's record open in our EMR to quickly log into CRISP and pass the patient context through to CRISP so that that patient's information is immediately available to them.
So with SAML and single sign-on, with CRISP for example, a MedStar clinician can sign on to MedStar's EMR, locate a patient, and without having to enter an additional user ID and password, simply click a link and get access to that patient's clinical information and information about visits at other facilities.
You can access the exact patient whose chart you're in. You can get their data just by a single click. When it's on the front end of the encounter, it enhances your ability, it gives you a more comprehensive view of where that patient's been, what tests have been done, and gives you an overall better picture of their clinical status. And the single sign-on has really enhanced our ability to access the data quickly, and in the emergency department, time is invaluable.
The value to patient care is that the additional information can support decision making on behalf of the provider. This may lead to reducing utilization by not requiring that we perform redundant tests on that patient. There can be cost savings. One opportunity that always comes to my mind is that in the healthcare industry, we perform a lot of radiology studies, for example. If we can reduce an unnecessary CT scan, for example, that's significant radiation that patient avoids, as well as significant costs that we're able to avoid. And there are many examples like that, I think, that we can take advantage of because of our partnership with CRISP.
So the single sign-on solution and the use of SAML really improves the user experience. They don't have to remember multiple passwords, they don't have to remember multiple user IDs. It's inherently secure, so we're not passing passwords back and forth. So you're not having to worry about phishing attacks, about people getting their identity stolen. It's an open standard, it's platform independent, and it also simplifies administrations of user IDs and passwords, and that's a real benefit.
I can't say enough about the collaboration between our Information Services Department and CRISP. I think it has worked very well on both ends, and I'm looking forward to more collaboration between the groups, perhaps diving deeper into the data. I'm also very hopeful that this will allow CRISP to reach out to other opportunities throughout Maryland, the district, or neighboring states to bring this valuable information in to all of our healthcare organizations because of the benefits to patient care and the healthcare system in general.
So overall, in many of these areas, we're able to better care for our patients in a more timely fashion. And CRISP gives us that access on the front end of the patient encounter. So from all these areas, CRISP has really been beneficial to us here in the emergency department setting.